Welcome everyone to the Dayton VA Medical Center's Tricare, Medicare, and the VA, How They Work for You webinar. We are thrilled to have so many participants on today's session. I want to start by saying this event is being recorded, so if there is something you missed and later want to rewatch, you'll be able to do that. We will be sending you a link to that recording after the event. You can also share that link with anyone you feel may benefit from the information we are sharing tonight. I'm Brandon Zeta with the Community Outreach Office at the Medical Center. I'm a Marine Corps veteran, and like many of you, once had many questions about VA healthcare. So let's see if we can answer your questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar, which is why we're keeping everyone muted. Again, this is simply to ensure that there are no distracting background noises. This doesn't mean that we do not want to hear from you. If you have a question or concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane in the bottom right of your screen. Simply type in your questions, and one of the presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of the presentation. Now we'd like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to your Dayton VA Medical Center.
Hi, I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose is not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
Thank you, Mr. Murdoch. While we have a long history of veteran care here in Dayton, this year marks the 75th anniversary of the modern Veterans Administration. We are proud to be not only one of the oldest campuses, but also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's also top rated by the veterans who it serves, with a more than 98% satisfactory rating. This is a benefit that not everyone is able to receive. This is only available to veterans. Well, that's one of the reasons we are here tonight. For those who are not enrolled with the VA, we hope you take the opportunity now to do so. And it is easy. One way to visit the Dayton VA Medical Center. One way is to visit the Dayton VA Medical Center and stop by the Enrollment and Eligibility Office. They will be glad to help walk you through the process. You may want to call first to schedule an appointment. The number to call is 937-267-7608. They will tell you then what documentation you will need to bring with you to determine your eligibility. For the tech savvy, you may also enroll online at www.va.gov. Veterans may also reach the National Call Center to apply at 877-222-8387. And finally, veterans may mail an application directly to the Dayton VA Medical Center. You can also enroll in person at the surrounding community-based outpatient clinics. They are located in Lima, Middletown, Richmond, and Springfield. And we'll share detailed contact information and phone numbers again at the end of the presentation. So now the reason we're here tonight, let's hear from our subject matter experts who can tell us more about how veterans can receive benefits from the VA, specifically about Tricare, Medicare, and the VA, and how the VA is here to help you.
Hi, my name is Debbie Payton. I work for the North Central CPAC, and my position is a program specialist, and I deal with the Tricare veterans that come to the facilities. So today what I'd like to talk about is Tricare billing. When a patient comes into the VA medical centers, they can have Tricare health insurance, or they can be seen as what we call a veteran, in a veteran status. You are considered a dual eligible veteran, meaning that you can be seen under your Tricare benefits or you can be seen under your veteran benefits. And we will talk more about the co-pays and the cost shares that are associated with this type of health insurance. So the way Tricare works for a facility, if a veteran comes in and he says, I have Tricare that I would like to have billed, and we will counsel the veteran on the aspects of how they are going to deal with their Tricare. So what they have to do is that when they come to the facility, they will sign a form, and it's called an affirmation form, or sometimes we mail them out to the veterans, and they will sign the affirmation form for the date of service that they want to be seen for. When they sign that affirmation form, we will bill their Tricare, and when Tricare pays, they will pay the cost shares that is associated with the bill for the Tricare. And if they were not going to use that and they wanted to divert back to being a veteran, then they would pay the veteran copay instead of the Tricare cost share. So Tricare is considered a benefit for those that qualify for the insurance coverage, and they can be active duty service members. They can be federal government, like employees if they have it. The Tricare is considered a benefit within the VA and does not work like an insurance when it's utilized within the VA system. Veterans with Tricare are considered to be dual eligible veterans, as I had said earlier, and they must choose from what type of benefits that they want to use under their Tricare benefits when receiving care at a VA. They cannot be seen under both. They have to make a choice of being a Tricare beneficiary or a veteran. So if they're seen as a veteran, they're subject to the veteran copays, and it's one copay per day. So if you're in a specialty clinic, it would be a $50 copay. If you are in a primary care clinic, it would be a $15 copay. When you're seen under your Tricare insurance, you're subject to the deductible on the Tricare policy. Then you would be subjected to the cost share when we bill it. And sometimes if you see more than one provider on that specific day, we will bill each provider, and there would be a cost share associated with each one of those. So if you're being seen as a veteran, it's one copay per day. If you're seen under your Tricare benefits, you'll have a few copay or cost shares, or you could have there's going to be at least 2 copay or cost shares when you use your Tricare benefits. Okay, so the types of Tricare, there's different plans. You have active duty service members, you have retired military, you have reservists, and then you have family members of the service member that can utilize their Tricare insurance at a VA medical center. The types of Tricare insurance, there's examples that would include Tricare Prime, Tricare Prime Remote, Tricare Select, and Tricare TAMP. If you have any questions at all, again, my name is Debbie Payton, and I'm at the VA Medical Center in Cincinnati. You can call me at area code 513-487-6068. I thank you so much.
Hello, I'm Kimberlee Wilson, Financial Revenue Manager of North Central Consolidated Patient Accounts. I am an Army veteran of 8 years, and first I would like to say if you are a veteran, I highly recommend that you enroll at the Dayton VA Medical Center. You are awarded this benefit because you are a veteran. When you step in the door at the Dayton VA Medical Center, the VA Medical Center is awarded funds for every veteran that is treated here. So by you enrolling, you are helping the next veteran receive his needed care. I represent the billing side of the house. By enrolling in the VA healthcare system, many people come with questions about Medicare and other health insurance and how it is billed. If you have billable insurance or Medicare with a secondary plan, your insurance will be billed. If Medicare only without a secondary plan, Medicare will not be billed, as Medicare is a government entity and government cannot bill the government. Medicare does determine if the secondary insurance pays or not. If Medicare denies, then the payment will be denied. If you are a disabled service-connected veteran, your insurance will not be billed if in relation to your service connection. There are income thresholds that the VA goes by. They are called priority groups 1 through 8. These priority groups determine if any copays you might pay or if your insurance will be billed. These priority groups also include prescriptions. I am questioned often as to why Medicare is needed when care is received through the VA healthcare system. A veteran receives VA Medicare medical care due to the benefit of having served in the U.S. military. Medicare is like having car insurance. You may never have an accident, but you know you have it. Medicare covers the veteran should you need outside medical care. Say, for instance, you have fallen at home. By law, if an ambulance is called, they will go to the closest civilian hospital for treatment and stabilization. Once stabilized, and if the VA hospital has an open bed, a transfer can be arranged. And that concludes today's presentation in reference to Medicare and its benefit. And once again, as I said, as a veteran, you have these benefits at the VA hospital once you're enrolled. My billing number and customer service line is 937-268-6511-3913. Thank you very much.
That was a great presentation. And with many questions veterans have about healthcare and quite possibly misunderstandings, that's one of the reasons we are hosting this webinar. The VA is not only dedicated to providing the best care possible for our veterans, but also to better understand their unique needs. The VA is here to help. That's why we have assembled a panel of experts here to help answer your questions. Let me introduce you to these professionals now. Kim Wilson has worked at the Dayton VA Medical Center for 30 years in numerous positions and currently serves as the Financial Revenue Manager. She also served in the United States Army for 8 years. Deborah Payton has worked with the VA since 1975, where she has been involved with helping patients, spouses, and family members to navigate through the healthcare system, through the VA healthcare system. She currently works with the North Central CPAC, which is for Consolidated Patient Account Center, in establishing best practices for veterans, active duty service members, spouses, and dependents to receive the best care possible through the VA. Again, I am your host, Brandon Zito, with the Medical Center's Community Outreach Office. I'm a Marine Corps veteran and will help answer any question you might have about the Dayton VA Medical Center in general. Now we're going to take some time to answer questions we've received through the chat pane, and we have a couple already. Please remember, if you have a question, feel free to ask it by typing it into the chat pane. You can find that on the right of the screen. We'll get to it as soon as possible with the time remaining. If we don't get to your question, please know we still want to answer it. We will give you a way to contact us at the end of this presentation. And the first question appears to be from Alan, and I'll put this question to our subject matter experts. Why is the VA not considered health insurance?
Good evening, everyone out in the VA hospital is not considered medical insurance. Or a hospital that the veterans come to as a benefit for having served.
Okay, thank you, Kimberlee. We have a next question from Michael, who has asked if there are still restrictions for coming in for an appointment. I'll take that question. Masks are still required and are available in dispensers when entering the medical center. The temperature checks upon entrance by our volunteer staff, those have ended. There is a COVID-19 self-screening upon entrance to the medical center that asks if you're exhibiting COVID symptoms that you exit and contact your care team. We have a question now from Shannon that asks, are you saying that veterans' spouses can go to the VA? Yes, if that's what you're asking about from a COVID-19 standpoint, yes, a veteran spouse can accompany the veteran to the VA. Family members can, just no children under the age of 5. Lois has a question. Where does Tricare for Life fit in? So I'll hand that over to our subject matter experts.
Hi, this is Debbie. Tricare for Life, with the VA not billing Medicare Part A and Part B, we have a tendency to shy away from billing the Tricare for Life if the veteran wants to utilize his Tricare benefits versus his veteran benefits. And the reason why I say that is with us not billing the Medicare, when we bill the Tricare for Life policy and they reimburse the VA Medical Center for that specific date of care, the 80% that Medicare does not pay is billed to the veteran, and that will become the cost share that he or she will owe the VA after the bill processes through Tricare. So basically what it is that you're paying a higher cost share due to the fact that we don't bill the Medicare when you're utilizing your Tricare for Life benefits. And when I send out the affirmation forms to the patients, and if they would send one back to me, I will actually call he or she on the phone, and I will counsel them on what would happen with the higher cost share versus the veteran copay. If that helps, let me know.
Thank you, Deb. Appreciate that. A question from Roger asks, if I have a va.gov account that shows my VA disability rating, does that mean I'm enrolled in the VA healthcare system, or do I need to do another step?
Roger, yes, you would need to do another step and enroll. If you have the va.gov account, it should have an enrollment application there. Because just because you have that account doesn't mean you're enrolled. You have that account just showing your VA disability rating.
Okay, thank you, Kimberlee. Another question, how does Medicare work if I have a secondary insurance?
So that would, as a Medicare being primary, and then you have a secondary insurance, your Medicare would be billed dependent on the Medicare Prime allowing the payment. The Medicare Prime would be the one to deny the claim.
Okay. Terry Glass asked, does the VA prescribe the COVID 5-day medication, and what are the criteria? I'll handle that, Terry. I'm sorry, I don't have the answer to that question at the moment, but I have your contact information, and I will look into that and reach out to you tomorrow with the answer for that. Got a question from Kristen. Is the decision to be seen as a veteran or a Tricare beneficiary a one-time choice, or do we choose for each visit?
Hi, this is Debbie. You will choose for each visit. When I send out the affirmation form, if you're in a specific priority group, and I focus on the 7 C's through the 8s, what I would do is that I would attach a letterhead, and within that letterhead, you will find the affirmation form for the date of service that I would bill for if you signed it. So it's each date of service. It's not a specific date range. And like I said, it's whatever day that you're going to pick that you sign the form for that we're going to bill. Tricare.
Okay. Thank you. Patricia has asked, what is Medicare Prime?
When I said Medicare Prime, I meant to say when Medicare is primary, and then when you have a secondary policy, that's what I meant.
Gotcha.
We use those acronyms, and I have to explain it a little better.
Thank you. Alan has asked, I'm retired with an 80% disability rating. Are there copays for care for non-disability conditions, such as a routine eye exam?
No, Alan, they're not. If you're 80% disabled, you have no first-party copays on outpatient or pharmacy. But if you were to be seen for something that's not included in your 80% disability rating, and you did have insurance, we would bill your insurance.
Okay, thank you. Gary has asked, I received hearing aids at the Right Pat, I believe WPMC is what he's referencing. As a retired member, they no longer have a hearing aid clinic. My hearing aids do not work properly. Will VA fix them? Similar to an answer I gave before, Gary, I don't have the answer to that right now, but I have your contact information and we'll reach out to you tomorrow with an answer. So please be patient. And Scott has asked, I'm 100% disabled and selected the VA as my provider. When I turn 67, will this impact or change the way Medicare A and B works for me?
Scott, no, it will not change the way Medicare A and B works, but we do not bill Medicare A and B if there's not a secondary. Medicare A and B by itself is government, and we're government, and we cannot bill the government. So we would only do that if you had a secondary plan.
Okay. Another question, why do I need Medicare if the VA does not bill Medicare?
I don't know the protocol of why you need Medicare. I don't work that side of the house. I only know if you only have Medicare, we do not bill it. So that would be something you'd have to get in touch with a Medicare consultant about.
Okay, thank you, Kimberlee. Deborah has asked, is Tricare for Life a secondary to Medicare?
Yes, Deborah, it is. Medicare for, or Tricare for Life is the secondary. So with us not billing Medicare, that's why the payment is less than like Medicare. If we bill Medicare, they would pay the 80%, and then the remaining 20% would be sent over to Tricare for Life to finish the process of the bill. But since you're being seen at the VA, with us not billing Medicare, then the 80% that isn't paid by Medicare falls upon the expense of the veteran.
Okay, another question. How does billing work if I am a disabled service-connected veteran?
Now, is that based on Tricare or is that based on just regular health insurance?
Regular health insurance.
I'm sorry?
Regular health insurance?
Oh, okay.
I'm sorry, could you repeat the question?
Sure. How does billing work if I am a disabled service-connected veteran?
So billing in reference to your first party copays or your insurance?
Insurance.
So like I explained, you will not be billed for anything service connected, outpatient, inpatient, or pharmacy. If you're seen for a non-service connected condition, then your insurance would be billed.
Okay. Terry has asked, if you receive community care and it exceeds your time limit, do we contact primary VA doctor or VA community care office to extend timeline?
I don't have the answer to that.
Terry, as we've stated before, we will look into that one. We've got your contact information. We have contact information for all registrants, and we will reach out to you tomorrow with a better answer on that question. So thank you. Okay, I don't see any more questions in the chat. Take a moment or two longer to see if anyone would like to ask one or two last questions before we end. Okay, well, that's about all the time we have for this evening's session. We hope you have found this event both helpful and informative. If we didn't get to your question, not to worry, you can call us at 937-268-6511, extension 2035 or 2195. Again, that number is 237-268-6511, extensions 2035 or 2195. You can also call our eligibility and enrollment office at 937-267-7608 for questions about how to enroll with the Dayton VA. Again, there are several options for enrolling with the Dayton VA Medical Center. If you are not currently enrolled but would like to enroll with the Dayton VA, here's how you can do it. In person, online, call center, or by mail. You can also enroll at the surrounding community-based outpatient clinics. And as before, we mentioned they are in Lima, Middletown, Richmond, and Springfield. And you can see their phone numbers on the screen now. We hope we've answered your questions for your health care and needs in VA in general and are ready to enroll. Thanks to our panelists for all their great information they have shared with us this evening, and thanks again to everyone who attended this event. Have a great rest of your evening, and thanks to all our veterans for their service to a grateful nation.